The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You are watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, big topic, male hormone replacement therapy. More and more men across the U.S. are going in to see doctors, integrative medicine doctors, for bioidentical hormone replacement therapy. And of course, we have San Diego's expert and probably the best shaped medical doctor that I've ever met, Dr. George Weiss. Dr. Weiss, welcome to the program.
Thank you.
All right. Now I should mention also that you're my doctor, and so that's good. Even though this is not an endorsement for you, I'm just interviewing you.
Thanks.
So, for people that don't know you, tell us a little bit about your practice. I mean, who's the typical patient? Who goes to see you?
I have what is called an integrative practice, and I have both men and women. Typically, I have more women than men because I do sort of like a preventative natural hormone replacement, and women are usually the first candidates because they like to come and see the physician more often than men do.
Okay.
But it has recently taken a change where men are becoming much more interested in preserving themselves.
You say they're
better.
men, you say, are coming out of the closet about hormones. Elaborate on that.
Well, it's funny the way you said it, but what's happening is most men, being very macho, hardly ever talk about any kind of sexual dysfunction. Women have
That's true. I guess when guys are around each other, that's not what we talk about.
All they talk about is how wonderful they are and how much libido they have, etc.
Okay.
Unfortunately, that is not usually the case, and most men have never been able to do anything about it. But because of Hollywood and because there's so many things...
You say Hollywood. If a guy looks good at 50, probably he's doing hormones.
More than
Even
like
San Diego. I mean, if they look good, you say, they're in the gym, you look at them, they're in shape, they're doing hormones.
More than likely. I mean, I can't be 100% sure, but typically speaking, what happens is right after the age of 30, our hormones start to decline about 1 to 2% every single year. Same thing with the metabolism, it starts to decline. And the same thing happens with women as it does with men right around the age of 30. And in women, we call it the perimenopausal phase. And then eventually they reach that menopause where they stop losing their hormones. We have now discovered a syndrome, not that we discovered it, it's always been there, but we now have actually coined a syndrome called andropause in men. And what andropause is very similar to the perimenopausal phase in women. The difference is that women, once they reach menopause, they stop losing their hormones, more or less. But with men, the andropause continues on forever. As the hormones start to decline, some of those process of aging start to develop. And it's not so much that we can necessarily stop the aging process by replenishing the hormones, but we can stop those diseases that go along with the aging process and also the symptoms that develop as a consequence of losing your hormone. And one of the first things that happens as you reach, let's say, around 40, you start to notice for the first time, energy goes down a little bit, aches and pains are going up. If you go out in the gym, if you work out in the gym, your muscles are a little bit more tight, and it takes a lot more time to recover and to develop the things they used to be able to do without any effort.
So you're saying with hormones, though, that can be reversed?
Well, it's more than just hormones. It has to be an integrated process. Okay. We have to be on a proper nutrition, proper supplementation, proper activity, and what we do is we have to measure levels, because as you get older, certain hormones, the wrong hormones go up and the good hormones go down, and that's why people start feeling that aging process.
You know, one of the things you say is, and I know your age, you look at least 15 years younger than your age, and you say that you can't even hang out with guys your age.
That's true. I do not, because a lot of guys my age have already given up. They just kind of sit around at home moping around, and I'm very energetic, and even my kids can't keep up with me. So, it is an attitude, it's also the way you feel about yourself, and all of that has to do with hormones. And many times what happens with men is they don't recognize that as they're aging, they start to develop this depression, anxiety.
Did they tell you this, by the way? So these men, they come in 50, 60.
Yes.
They sit in front of you. I mean, what's their main concern? What do they want?
Forget the 50 and 60. We have men as young as 30 to 40 years old who are coming in already complaining of being tired, exerted. Their muscle mass is not what it used to be. They work out harder with less results. And the problem may or may not be hormonal decline. It depends on the individual. But a good majority of the patients are starting that slow process of hormonal decline. And once we reestablish or we bring back that hormone to a more youthful level, they start to see the immediate benefits for it. And they feel much better. Typical patients that I have are some of these executives who have been on the go A type personality, and they're used to staying up late and they used to be able to do anything they wanted to. And now suddenly they come to me, they tell me,
I hit a wall, I can't sleep.
I can't sleep. I'm tired all the time. I don't have the drive I used to have. I'm depressed. My libido's down. I don't know what's going on. I'm fighting with my wife. I'm fighting with my girlfriend, whatever the case may be. And once we test them out, we recognize that they started to have that diminished hormonal syndrome.
Okay.
And part of that syndrome can be obviously rectified by not physiologic, but therapeutic doses. There's a difference between physiologic or super physiologic doses.
Okay, so we're talking about, that means returning their testosterone levels back to when they were 18 or back when they were in their 30s?
Well, what you want to do is you look at levels. Everybody has a different level.
Okay.
And we have to measure, the importance is not only to measure your total testosterone, but you measure what is called the free or unbound hormone. So you can have a very high testosterone level. A typical doctor may test you and say, well, you're perfectly okay. When I test them, they may have a high total level, but their free testosterone, or the unbound testosterone, is very low, and that is the active form. So you have to be able to understand the difference between just testosterone and the available testosterone. So
let's talk about the commonly replaced hormones. Mm-hmm. Okay, so a man goes to you, you've done the blood work or saliva or whatever. What are the commonly replaced hormones in men?
Well, the most common would obviously be testosterone, okay. But there are.
Let's start there.
Okay.
How does a man know if he has low testosterone? What are the symptoms?
Well, typical symptoms would be loss of energy, noticing that they're starting to put that little tie around the middle, and there's a genetic predisposition right around the age of 40. As our hormones start to decline, men start to put that little fat around the middle.
Okay.
And I'm sure you're aware of that too.
Yeah.
And it becomes a very hard thing to get rid of.
That's why I wear a girdle. I'm kidding.
Right. And unfortunately for some men, it can decline so much so that they can develop what we call the metabolic syndrome, or they become diabetic. Typically speaking, men who are obese or have a large midsection, and especially type 2 diabetic, it is a known fact, and there's been many studies to show that they are hypogonadal, means that they have low testosterone level. And unfortunately, the fat becomes estrogenic. Now, men have some estrogen, believe it or not.
Okay.
Not as many as women do, because, of course, they would have a problem. But we have enough estrogen so we don't kill each other. Problem is that as you become fatter, or if you're a diabetic, that fat around the middle becomes an estrogen producer. And
interesting.
And what happens is some of those men start to develop the man boobs. You've heard of that expression.
Yes, yeah, I've seen it.
Not only does the fat increase the estrogen level, but it can also increase the inflammatory response in your body, which then can cause heart disease and hypertension. But also, you develop what is called the insulin resistance, and combining all of those things.
So testosterone turns that around?
Absolutely.
Okay,
One of the hallmarks of diabetes, for instance, is to be able to utilize the glucose and the insulin level properly. By giving you testosterone, what you do is you increase your muscle mass. Therefore, your body becomes much more efficient in using the sugars and the insulin. And by increasing your muscle mass, you also decrease your body fat, so it has a positive effect.
Okay. But what about this, though? Now, you know I take testosterone because I get it from you. And for me, it's the daily activities. I have an 8-year-old. I have more energy at the end. And when I stop taking it, I'm tired at the end of the day.
Right.
But my point is, people will tell me, because I tell guys in their 50s, in their 60s, they're very successful. And I say, you got to get on testosterone. You don't know what you're missing. And I hear this all the time, and I don't have a great comeback. They say, problem is, my father had, prostate cancer, or, I don't know. I don't want to grow cancers. I don't want to put myself in that position. So, I mean, what do you say to that?
Well,
it is a good question.
Absolutely. And that's why you have to test for everything. You want to make sure that you're doing the proper testing. We check PSA levels and so forth. The misconception about testosterone is that testosterone is causing the prostate cancer. There's absolutely no evidence that testosterone causes prostate cancer. What is, in effect, true, if you happen to have a prostate cancer, hormones can accelerate that process, but it isn't the causative effect. As a matter of fact, it turns out that men with low testosterone levels have a higher incidence of prostate cancer than men with high testosterone level.
Okay.
So, I'm not saying you have to treat prostate cancer with testosterone. That's not what I'm trying to tell you. But it is not true that testosterone is the one.
I mean, I have a urologist.
Yes.
You know, and I think you talked to this guy, Dr. Lander.
Yes, he's
and,
from.
and he treats men that have had prostate cancer.
Yes.
You know, a year out with testosterone. I mean, he gives them testosterone. So, but you're saying so it is healthy. It's not a concern. You're saying.
Well,
as long as it's balanced, not too much.
Well, it's not a question of too much or too little. What you have to do is you have to qualify the individual. You have to test out. If somebody happens to have prostate cancer, I would not treat them with testosterone, obviously.
Okay.
What I was trying to tell you is that testosterone is not the cause of the prostate cancer. It's sometimes the low testosterone will be more indicative of people who might have prostate cancer. And you're right. When I find somebody who has a very low testosterone level, I will frequently refer them to a urologist to make sure that they do not have prostate cancer.
Okay. Now, one of the things you do, I mean, you're taking care of, you have, getting them to sleep, the right kind of exercise, the right kind of nutrition, because also, I mean, you're into weight loss as well, and hormone replacement when necessary, and supplementation.
Right.
So on day one, when a guy goes to you, okay, so this guy goes to you, he wants that edge. You call it the hormone edge.
Right.
What happens on day one?
Day one, I always do a very intensive history and physical, but it's more on a one-to-one. I want to find out exactly what's going on with that individual. I want to know everything about them. Okay. And then I test them out to make sure that those symptoms go along with the laboratory values. And then afterwards, we sit down again.
So what, they come a week later?
Yes. A week later, 10 days later, after we get the results back, and we sit down, we go over everything, so we combine the symptoms with the laboratory values. It can't be just one or the other. Medicine is both an art and a science. And the problem is with many very busy physicians, what they typically do is a person will come in complaining of diminished libido, no sexual function, increased weight gain, they have diabetes, they have all kinds of symptoms that appear to be a hormonal decline, so they'll test them out. And then the nurse will call them up, and they will call them up and tell them that their levels were within normal limits. Well, within normal limits is a very wide range. For instance, total testosterone can go anywhere from 250, depending on the lab, all the way up to 800 to 1,000. So it's a very wide range in numbers.
Okay.
If for instance, an individual comes back with a testosterone level of 260, and he's only 40 years old, the nurse will call him up and say, "Doctor, looked at your labs, everything is fine, you're within normal limits, you don't have an issue, go on Prozac." And a lot of my patients have actually gone on antidepressants because they've had sexual dysfunction, and guess what? It only exacerbates the condition even more.
I mean, is your goal to get people off of these things?
Absolutely.
Okay.
Most guys, if they have a hormonal decline, once we reverse that, once we put them on of course, you can't do it without proper diet, proper nutrition, proper supplementation. You have to have the activity level combined in it. And then by replenishing the hormones or bringing them back to a more youthful level, they suddenly feel the same way they did 20 years ago. They have more energy.
Do they tell you that really?
It's a fact. Well,
okay.
Look at you.
Well, I noticed the difference just with testosterone with energy.
Right.
You know, to me, it was more energy.
It's not just energy.
I think clearer, by the way.
That's the other thing. We
Memory's
know men with higher testosterone level, especially free testosterone, have greater memory, less Alzheimer's. So there's all this positive effect, not only by energy, but sense of well-being. They're fighters again. A lot of these guys, like as I was mentioning to you, some of these captains of industry that I've been taking care of, who have been always on top of everything, suddenly they feel a little bit meek. They don't have that same drive. They lost their mojo, so to speak.
Okay.
And once we test them out, it turns out that they have low hormones. And once we replenish those hormones, they get that same drive back, that same sense of well-being.
And like they want to take on the world.
Take on the world. And also their sexual function improves tremendously. So there's a bonus in all of that. So it becomes a whole different being again. They get back their youth.
But thyroid, and we haven't talked about thyroid. What role does thyroid play?
Well, thyroid is the metabolic hormone, obviously, and it has to do with energy, has to do with weight loss, and actually a low thyroid can be indicative of some other hormonal imbalances. So if your thyroid is not functioning properly, all of the other hormones are not functioning properly. And typically speaking, even with women, for instance, if they have a menstrual irregularities, the first thing we have to check is their thyroid level. And the same thing with men. We're going to look at the thyroid in addition to the different hormones because they all have to be balanced. The body is a very interesting mechanism, and you want to have the perfect balance between all of the different hormones. For instance, you have every cell in your body has a receptor site for every hormone in your body. So they talk to each other. But if one hormone is deficient and another one is taking over, then you're not going to have that proper conversation between cells.
Okay.
So what we want to do is we want to bring back that balance. For instance, typically speaking, women postmenopausally, they lose 90% of their hormones. And I know we're talking about men, but I'm just using this as an example.
Okay.
And what happens with women after postmenopause is they start to have some of the same diseases as men, heart disease, etc. But also they start to put on weight and they put that fat around the middle. And a lot of that has to do with imbalanced hormones. And once you try to bring back the balance, bring the hormones into balance, they start losing weight again. They feel better. They have more muscle mass, muscle tone. And women also happen to have testosterone deficiencies just like men do. And so bringing the balance back, that's what it's all about. Not too much, not too little. You want to just do right. And usually the hormones in your 30s, right around 30s and early 40s, where it was at its maximum. You don't necessarily want to take it back to where you were 18 years old when you know, everything was a little insane and you didn't control yourself. But you want to bring back the proper balance. And again, the person will be able to tell you if they're properly treated. If you're not giving them enough, they're not going to have enough of the symptoms coming back. And if you give them too much, they're going to overreact.
At what age should a man start doing hormones, in your opinion?
In my opinion, there are men who are 30 years
old. Every 40-year-old should do it, in your opinion?
Well, I would say...
In my opinion, I think they should. Well, because I felt so much better.
There are genetic differences between people, obviously. There are some men in early 30s who already have started to have hormonal decline, and there are some who are even younger than that. And there are men who are in their 50s and 60s who haven't had the same issues as a 30-year-old. Typically speaking, though, the hormones will decline starting the age of 30, about 1 to 2%. So by the time you reach 40, you're going to start seeing those initial symptoms, you know, diminished libido, less muscle mass, takes greater time to recover. And then those diseases that go along with the aging process also start to develop at that same time because you put on more fat. Like I mentioned to you, fat is estrogenic. It's an inflammatory process. The metabolic syndrome develops in a lot of men. And in spite of some of the diet and exercise that they do, they're still unable to maintain that muscle mass or that vitality that they used to have. So when we treat them, especially if they have symptoms, they're irritated, they don't have the energy, the libido goes down.
Do you see miracle situations where a guy goes to you and just feeling lousy?
Yes.
And all of a sudden you do some replacement nutrition, get him on the right track for exercise, and all of a sudden everything's different?
Well, absolutely.
I mean, do you hear those stories? I mean,
I hear those stories all the time. I mean, this is exactly what happens, both with men and women, when we properly test them out and we find the issues and we correct them. And you're right. It always has to be an integrative process. It can't be just pumping hormones. I don't want anybody to think that that's what we do. We just give you a hormone and everything is fine. You have to combine it with the proper nutrition, proper supplementation. You have to have activity level. But if you don't balance that hormone back, regardless of what you do, you're not going to be able to get that vitality back. That if you're
what about growth hormone?
And again, growth hormone is a deficiency with age, but you have to qualify for it. You have to actually test out a person to see if they have an actual growth hormone deficiency, and if they do, then you can potentially utilize that to replace for growth hormone deficiency. But it has to be tested out.
Now, what are some of your older patients? I mean, what are the age ranges? People that are
like I said, I have patients ranging anywhere from 30 all the way to 80, almost 90, and it could be a professional. There are doctors, there are captains of industry, and there are people who work in a gym. And I have a lot of guys who are trainers, oddly enough, who have always been used to being in perfect shape, and all of a sudden they notice that they don't have that kind of energy. Their recovery times is becoming longer and longer, and they want to be able to maintain that vitality and the ability to...
Personal trainers, men are coming to you.
I have several personal trainers that even I was surprised because they're relatively young, that they already started to have such issues. And once we tested them out, they did have some hormonal decline. And so once we balanced that back up, they got that vitality back, their energy back, their sense of well-being, and they felt good about themselves.
Okay.
And that's the most important thing.
Are these creams? I mean, I take a cream, but you do injections, you do creams.
Everybody is, again, there is no one single way to treat. Everybody's a little bit different. Some people prefer certain things. I believe in that certain things work better on some people than on other people. It just depends on the convenience, and it's between the patient and the doctor to make a decision of how you want to approach this.
It's not expensive either, by the way. You know, I know your prices.
Yeah.
Less than a personal trainer.
Oh, for sure. It's well,
I mean, it really is.
Personal trainers, yes. If you look at it that way, yes.
Yeah.
Of course, if you have a personal trainer
Less than Jenny Craig.
Yeah.
It is.
Well, Jenny Craig's not going to bring back your energy, your vitality, your sexual function. It's very expensive meals, but that's about all.
So doctors will watch this show, and what do you want them to know about what you're doing?
Well,
because I'm sure there's misconceptions about what Dr. Weiss does.
Of course. And you know, in all fairness, typical doctors, HMO doctors, they're seeing 40, 50 patients a day. And when you present with all these complex issues, fatigue, loss of libido, energy, depression, anxiety, it's not that they don't want to spend the time, but they just don't really have the time to spend with the patient to really go over all the different issues that are going on. So a lot of times, those doctors will refer to me because I only see so many patients a day. It takes usually about an hour to really go through all the process to learn about that individual. And that's the kind of luxury, unfortunately, an HMO doctor doesn't have. Not that they wouldn't want to, but it's not realistic.
So you have more time.
And the problem is that most medicine in the United States is disease-modeled medicine. In other words, we treat the disease and instead of doing prevention. And the big difference and the key to what I try to do is to be more proactive, more preventative. Hopefully not to get them to the point where they have to have a disease, and that's when we start to treat them. Just to give you an analogy, if I take a number 1 through 10, 1 being perfect health and 10 being like death, typically speaking, symptoms do not appear till you get to about a number 7. But you can imagine by that time you'll have already too many issues going on, and it's a little harder to reverse the process.
Well, most men, and we're talking about men and hormones today, but everybody does, especially men. You know, we wait until there's a problem.
Well, men more so than women because we're so macho, and even physicians are the worst kind of patients because they take the longest to do anything about themselves. But typically men have an issue about going to a doctor, and I think we need to change that attitude. We need to really make them understand that it's a perfectly natural process that's going on, and if we can do so much about it to prevent it and to give them greater quality of life, improve their health, their energy, their sex drive, their libido, their function, and also at the same time diminish some of those age-related diseases that are related to the hormonal decline and the metabolic decline, and then getting fat around the middle, etc. So all of those can be mitigated and can be helped.
Now, what about a guy that, I know you address sleep, so you get people
Yes.
sleeping again. Tell me about that.
Well, it's important. The most significant thing is to be able to have a good night's sleep. As a matter of fact, when you sleep enough, certain hormones are produced, like growth hormone, which is very beneficial for you. And proper sleep is important because it diminishes your cortisol level, and cortisol will always cause issues and help. It increases the aging process. It ages you. So if you can get enough sleep, then all of these other hormones are properly balanced out, or at least more balanced out, and you don't have hormones fighting the good hormones, the bad hormones fighting the good hormones.
Okay.
So you need to get that. And as a matter of fact, for weight loss, people who don't sleep well actually increase their weight gain because of the cortisol level, and they usually put that fat around the middle.
We're completely out of time. Okay, final message.
Yes.
A guy out there that is just not feeling that good. Lack of energy,
Yes.
lack of sex drive, concentration. What do you tell him?
Typical patient. Well, I would tell them to have a workup because it's not necessary to feel that way. You don't have to age like your parents.
Have
and
your
grandparents.
hormones checked.
Well, have a complete physical, not just your hormones, but you must check the hormones, yes. Instead of just checking the basic stuff like cholesterol, liver, kidney function, it is important to look at the hormones, but not just one, look at all of your hormones and see if they're in balance. Because if they're out of balance, you're going to have all those side effects, and until you bring that balance back, you're going to feel lousy. So it's important to do a complete testing, and then including diet, nutrition, supplementation, activity level, you will feel like you felt 20 years ago.
Now, men and hormones. Okay, so men, they get in their 50s, now they've made some money, they have time to enjoy life.
Right.
You say the second half of your life should be the best half.
It should be. It should be, because typically these men have worked a lot of years and supported everybody, and instead of just dropping dead and having a heart attack, this is a time for them to be renewed, to be rejuvenated, to become the same individual. But the difference is now they have the money and the time to enjoy it, whereas before all they were doing is just working. And it's really the best, if you have the means, it's the best second half of your life that you can possibly have, because you have the means and you can bring back that youthfulness, and you don't have to age and become decrepit and old and osteoporotic and no function.
Do you see changes, I mean, physically, or changes in personality when they come in on the, a month later, a couple months later?
Absolutely. As I was saying to you, men who have diminished hormones will frequently be very depressed. They will have, they'll be very tired, depressed, lonely. Some of them actually become weepy. And this is something very unusual for men. And that's because
weepy men are out there.
Yes, there are weepy men.
They tell you that?
Well, they do. I mean, they are. You can tell. They said, "Look, I'm just getting so emotional," and there's nothing wrong with being in touch.
It's just
there's nothing wrong.
Weepy men out there.
Well, but and there's nothing wrong with being emotional. That is a good thing. But at this stage, they're just feeling emasculated, and they're not able to face up to any kind of challenges. And once we
so that's a hormone problem.
That it can be. I'm not saying that they're not people who have psychological issues, but a lot of these men, the issues are not so much psychological. They become psychological, but it's because of their hormonal decline. Once we adjust for that, frequently
they're less weepy.
Well, they become energetic. They get back that sense of
like
well-being. They get the drive back.
Okay.
Yes. And that's an important part in being alive.
And they're no longer crying at work when their boss yells at them, right?
Right.
Okay. Now, so if somebody wants to find out more, what do they do? Just call you, visit your website?
Yes, visit my website or call me, whichever is most convenient, and we'll be happy to talk to anybody.
All right. Okay. I want to thank you for coming on the show. Very good stuff. Good stuff.
And I hope you're doing well.
I am.
And don't forget
I'm taking your advice.
But also the diet and the activity is important. Remember that.
All right.
Okay.
You're watching the Wellness Hour, leader of medical news and information. I'm Randy Alvarez. If you would like more information about Dr. Weiss, you can go to our website. In our search, just put in Dr. Weiss or male hormones, and you'll find him there. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.
Hi, I'm Randy Alvarez, host of the Wellness Hour. We are currently looking for licensed health practitioners to be on the show. So if you have something to say, a great message, a new breakthrough, you have to let us know about it. Visit wellnesshour.com, click on how to become a guest, or just email me directly at randy@wellnesshour.com. If you know a doctor that you think would be great on the program, send them my way. We'll see you here.